Fantastic. All right, welcome to our webinar today for family caregivers. Just a brief introduction and housekeeping. Family Caregivers of BC is grateful to the Ministry of Health Patients as Partners initiative for allowing us to provide these webinar learning opportunities for family caregivers. Just a few notes for today. Please ensure that your mic is muted and your video is off. We've enabled the question and answer feature where you can type in questions which will be monitored and answered at the end of the presentation. The chat feature has not been turned on for this webinar. All right, so just a little bit about Family Caregivers of BC. I just wanted to let you know that Family Caregivers is a nonprofit charity dedicated 100% to the well-being of family caregivers for over 30 years, and it's the first of its kind in Canada. There are very few, only 3 provincial organizations across Canada providing this type of service focused on caregivers. We've been serving BC since 2010, and for the past 5 years as part of the Ministry of Health's Patients as Partners initiative. Our pillars include caregiver support, education, and engagement. In support, we have a caregiver support line that's available 5 days a week from 8:30 to 4:30 every day. That line provides information, referral, and navigation support. We also have caregiver support groups, both in person and virtual. We have some of our own, and then we also support other organizations in the province running their support groups. We have caregiver coaching available through the caregiver support line after you do a quick assessment. And then we have a caregiver resource center on our website that's loaded with information and resources. In terms of education, we offer newsletter publications, e-news, articles, blogs, videos, podcasts. We support group facilitator training, and we also support outreach to community groups. In terms of engagement and collaboration, we try to engage for quality improvement in health policy. We provide presentations and we participate on health committees. We collaborate around and with condition-specific organizations, health authorities, and we try to participate and contribute to Ministry of Health research. All right. I would like to take a moment here to acknowledge the territory on which I live and work. I'm humbled to be speaking to you as a settler from the unceded land of the Lekwungen and Saanich nations, which are part of the Coast Salish peoples. I wish to acknowledge and thank these people, also known as the Songhees and Esquimalt First Nations, for allowing me to live and work in this territory. Michelle is going to add her statement here as well.
Thank you, Victoria. I would like to say that the University of Manitoba campuses are located on original lands of the Anishinaabe, Cree, Oji-Cree, Dakota, and Dene peoples, and on the homeland of the Métis Nation. We respect the treaties that were made on these territories, and we acknowledge the harms and the mistakes of the past, and we dedicate ourselves to move forward in partnerships with Indigenous communities in a spirit of reconciliation and collaboration.
Thank you, Michelle. Let us please take a moment to consider the impacts colonization has had on the First Peoples of this land. I encourage each of us to contribute to organizations committed to resolving disputed territories and taking time to learn from Indigenous communities about the costs and impacts of colonization. All right, our presenter today is Dr. Michelle Lobchuk. She is with the University of Manitoba, and I have a lovely extensive bio here, and she said to me, oh goodness, that's a lot. So she wanted to just have me focus on the fact that she researches empathic communication and is currently teaching a family caregiving across the lifespan course. She's been active in her career in working with family caregiving and empathic caregiving, and she's just been an absolute force to contend with. We feel very blessed and very lucky to have her here today.
Thank you, Victoria.
Oh, it's absolutely an honor. Just moving on now, Dr. Lobchuk is going to take over the presentation and I will be handling slides for her. Just a reminder again, please do put your questions in the Q&A. If you have any difficulties, you can, I think you might be able to put things into chat. We will be monitoring and the questions will be saved for the end. All right.
Here I go. Oh, I'm so happy to be here with everybody. It's an honor to be with you and, you know, to talk about this important topic, which really is about you. And out of respect to you, we're going to delve a little bit deeper in terms of giving you some skills in terms of how to appreciate yourself as a family caregiver. And I could share with you right now, my husband's going through a situation, so I could see exactly things that I'm going to talk about reflected in his own experiences as a family caregiver to his mom, who's dealing with dementia in the hospital. So the title of this presentation is Self-Reflection as the Basis for Being an Empathic Caregiver. The general aim is to highlight the value of self-reflection in the overall context of patient-centered care, which is probably a term that you've been hearing about, which really focuses on the relationships that we have as caregivers, both professional and informal, with the people that we are supporting and caring for. So what is an empathic caregiver? It's really about not being emotional, but it's really about getting in a space of trying to understand the other person's needs, understanding their behaviors, and also in relation to understanding ourselves in relationship with the person that we're caring for. And what I'm going to do is present some ideas to you, but I'm going to try to make it more concrete for you, where we're going to focus specifically on responsive behaviors of care recipients, of people that we care for. And responsive behaviors really are behaviors in reaction to the care recipient's response to the environment through distressing or challenging behaviors. So next slide. After this talk, these are things that you could hold me to that we covered. Again, we're going to cover the definition of self-reflection in the context of empathy as we provide care in the context of providing care to people dealing with dementia. We're going to also delve a little bit deeper into the meaning of empathy. I've been a student of empathy for the past 20 years, and there's many, many things that I realized about empathy that I want to share with you today. And we're going to look at it both as an individual act from our stance as a family caregiver, but also in relationship with the people that we care for. So it's both an individual and a social act. And then I'm going to leave you with two basic tools that come from the evidence that we know. It's not based on anything that I created, but these are techniques that are evidence-based that comes from research evidence. Next slide. So what is patient-centered care? And this is the overarching notion that we are hearing more and more about. And really, patient-centered care involves caregivers, both professional and family caregivers who are patient-centered. That means we care, we share, we communicate, and we develop supportive relationships with the people that we care for. So then you might ask, Michelle, so what does self-reflection have to do with patient-centered care? And that's a fair question. Really, self-reflection in patient-centered care is about being intentional. We communicate with people dealing with dementia. Often we have to be very conscious in terms of how we communicate with them because our circumstances have changed, right? Old ways of being, old ways of communicating, old ways of being understood have changed. So what that means is family caregivers, being an advocate, the primary person caring for a person dealing with dementia, is about active listening, also self-awareness of ourselves and why we behave the way we do towards people in our care. The benefits of self-reflection is that we become more appreciative of ourselves as this human instrument to enhance outcomes for the patients that we care for. We reflect on our morals, our values, and also it may cause us to be less judgmental, because when we attempt to understand what the other person's needs are, when we understand who we are, it's easier to control what our beliefs, our preferences are in order to step inside momentarily inside someone else's shoes to try to understand who they are. It's not easy to do, especially when you're a fatigued caregiver, but it's something that we are called to do when we try to provide patient-centered care to patients. Evidence also shows that when we behave in an intentional way, but the care recipients feel that their needs are understood, their mood improves, and also their relationship with us improves as well. Next slide. Let's start off by you and me. Each of us has our own lenses by which we view the world outward, but also our lens in terms of how we reflect on ourselves, as I said, on our morals and our values. So I want you to really think about this lens that you have that helps you to see the world and interpret the world, but also in relation to our stance and our viewpoint, which is really, really important. Next slide. Self-reflection, I want to give you a definition. Johns is an expert in the area of self-reflection. He's actually a pioneer. And let's break down his definition. He describes self-reflection as a window in terms of how to view oneself. And I already mentioned a lens. What are you viewing? Well, it's your lived experience as the family caregiver. As you think about behaviors in the situation and how you are feeling and why you respond that way to that other person. It's ways in which we confront the way we view the world, the way we understand the world, and how we try to resolve contradictions that often exist, especially in family caregiving, where we are used to being a certain way with a person, but due to their diagnosis, circumstances are now changing. And now you are being called to respond differently towards that person, still within the context of having known that person, but now the expectation is now a new understanding, a new way of behaving and responding towards that person. And sometimes it can cause conflict within us because we're used to behaving a certain way towards people. And it causes a term that we call dissonance. And I'm going to describe it to you a little bit more fully in the next slide. Next slide. Okay, so self-reflection. What do you mean, Michelle? Can you tell me a little bit more about self-reflection? It's more about trying to understand your values in the changing circumstances. What is important to you in terms of your new role as a family caregiver? Many of us start out as being spouses or as mothers or as daughters or friends. What are your values? And do you find them changing or not really? Do you find your values something you still want to extend to that other person? But it's all in the context in terms of how that person now is reacting to you, especially in the context of dementia care, where responses towards you is now different. Do you find yourself being judgmental in terms of what is worthy of your attention now because they are being responsive through behaviors that are more negative? And now, do you find yourself challenged in terms of being able to express your values towards that person and applying it in a caregiving role? So sometimes when we don't find a fit in terms of our personal values and what is now being called upon you to be a family caregiver, it can cause discomfort, fatigue, stress. Next slide. So let's define responsive behaviors a little bit more closely. And I draw upon the definition by the Alzheimer's Society. Wonderful resource. They define responsive behaviors relatively recently as verbal or physical reactions or actions that can be disruptive, distressing, or challenging. And I could really see that. And I see that by listening to my husband as he comes home from the hospital, the way his mother is now reacting towards the nurses, towards himself, which is really uncomfortable, right? But why, you really want to understand, why are they doing that? Because I think I'm behaving towards them the way I used to behave. They recognizing me, and why are they responding differently towards me? Well, it's often there's some meaning behind their behavior, and they're having difficulty expressing what their needs are, right? What their preferences are. And it could be as a result of pain or loneliness, or, for example, many of us have to work with people as they get admitted into supervised care, such as long-term care. Sometimes people express themselves, they don't really want to be there, and they could express themselves through these distressing behaviors that we can actually reflect on our behavior. Do we react out of fear ourselves? Are we embarrassed by how our loved one is acting? So you can see this is really a complex situation that we're trying to tear it apart and try to understand it a little bit better from the context of self-reflection, which is so important. And I don't think we talk about that enough. So what do you do as a caregiver in these kinds of situations? Next slide. Well, if we understand empathy a little bit better, empathy as an individual act in terms of being able to reflect on and sometimes being able to accept in dementia care that we can't always control how people respond, right? We can't always change the behavior, but what we can change is our own viewpoint and how we reflect on that other person's behavior. For instance, we may realize for the first time actually acting out they might be trying to tell us something, right? And they're trying to get us to listen. As though we have to be able to value our own feelings, right? And that starts by reflecting on our feelings as a result of that episode where maybe that person was trying to act out and try to tell you something. And once we're able to do that, then we might be able to become interested in what they're trying to tell us, right? Where we start from a place of knowing ourselves as this valuable human instrument to try to meet people's needs. Understanding others starts with knowing ourselves, and I might repeat that several times during this talk. So why is this important? Why is self-reflection important? Next slide. I do want to start out by saying, you know, we're all so busy. And I could talk like this to my student nurses who I teach. I could talk to busy clinicians, and I could also talk to you. There's something about us that we seem in the 21st century to be busy, very busy people. But if we don't stop and self-reflect on who we are and respect where we are coming from, that kind of makes us selfish. And those sounds like harsh words, but if you understand what I'm trying to say is that when we don't stop and reflect on ourselves, we're dishonoring ourselves. We're ignoring ourselves, which can help us understand our interactions with the other person who we're trying to understand. So the plan of action in terms of what can I do to be engaged in empathy and self-reflection as an individual act is to develop this mindset of introspection. And you could ask yourself these questions. Have I behaved in a manner that can be considered dehumanizing? When we don't know what to do, and sometimes we might get angry ourselves. How do you think it makes that other person feel? Probably escalates that responsive behavior. Ask yourself, do I really want to argue with that person? And I see that in my husband's family and some of the other siblings. They want to argue with the mother, and it doesn't really seem to help the situation. Do I want to be happy and savor the moment? The next question our next point is to look at your personal values and look at it in light of the caregiving role values. Is there a fit? What do you consider worthy of your attention? And I've said that already. What is high priority to you in paying attention to that other person? Can you reflect on what is acceptable behavior to you? What are the boundaries in terms of what you accept? As a former person who was in another role with that person, and now you have to see them in a different light. How do you see them personally? How do you see them as a caregiver? Are you being called upon to see them differently? Which can be challenging, right? The other point is express your personal values in this role. Because when you're able to do that, we develop resiliency and sustainability because you respect yourself with your own values and your preferences. And sometimes we can rework that, a workaround in terms of how to apply your personal values as a respected human instrument, as a family caregiver, trying to enhance your care for the family member that you're caring for in order to enhance congruence between your personal values and now what you're being called to do as a family caregiver, to now meet new needs for this person that you once loved or admired or cared for. And there's greater commitment to these values, greater commitment to yourself as you apply yourself in these roles. I mentioned to you that I was going to mention or describe the term, the psychological term, dissonance. And dissonance is reflected. Do you ever feel tension or conflict? And are you aware of these conflicts between what you believe is desired and applying yourself in those situations? And what is preventing you from doing that? That could create dissonance, tension, conflict. Next slide. So just some additional questions for you. And yeah, of course, you don't have time now to answer these questions, but there might be a work piece that you yourself later. But you want to not only reflect on yourself, but reflect on the behavior and ask yourself, and again, this comes from the Alzheimer's Society, is that responsive behavior from that other person a problem for that other person who you're caring for? Or is it more of a problem for you that creates anxiety? And that, start saying that. Do you think that there's a need for you to change your expectations about the problem, which might suggest enhanced understanding of why they're behaving that way? And why are you having this reaction to that behavior? So it really helps you to recognize that as a trigger when you sense these kinds of questions happening. Pay attention to those kinds of questions. They're valuable questions that help you understand yourself and the other person when you stop and self-reflect. Some additional questions in the next slide to ask about this are, again, in this situation, when you begin to question, what are your personal values about the essential elements of what my loved one is trying to express? And then ask yourself, what are the barriers that are preventing me from enacting my personal values about caring, about sharing, about communicating, right? And trying to develop this therapeutic relationship. Next slide. Again, to repeat as a guide for yourself, what is worthy of your personal attention in providing this care to your loved one, to the care recipient? Do they deserve my respect and non-judgment? Are they not to be oppressed in terms of how you think about their rights to be treated with dignity? What can help you enact that? They're not to be treated as an object, but as a human being with their own preferences and their own beliefs that they might have a hard time communicating to you. Do you give them an environment in which they can share what their thoughts are and maybe even have input in terms of the decision making? Next slide. So there are a whole bunch of things that we covered in terms of empathy, driven by self-reflection as an individual act. But once you've done that first and understand yourself better as this human instrument, now we really can engage probably more clearly in your mind in empathy as a social act to develop these relationships, new relationships with a person that we might have behaved differently with in former years as we knew them. But then you could say to me, Michelle, what you're asking me is a lot because it is so stressful. Caregiving is a stressful situation. And in light of to admit, first of all, to ourselves, and I think in this busy world, we don't listen enough to each other, and listening is the first step. It's not really part of our daily rapport, right? We all have these checklists that we need to get through the day that can actually be a distractor from paying attention to ourselves and what that other person is trying to say. And in the caregiving situation, just to acknowledge some of these things that might serve as a barrier in the caregiving situation. For example, there's many demands put on you. I could think of my husband's sister right now. Her own family expect her to babysit, even though she's coming to the hospital and spending the night with their mother. She also has task-driven care, what she needs to do at home when she gets home from the hospital. There's a lack of role modeling. Really, I find, unless we join a support group where people openly share how they engage as a family caregiver dealing with a dementia situation, it's pretty challenging, right? Because our loved ones don't, just like they say with babies, people don't come with handbooks in terms of how to deal with this. So it's just so challenging to try to find good role models. Essentially, as a caregiver, do you feel supported by others? Do they regard you in terms of what your needs are in that situation, which is so important? And it's so okay because the rest of the world is demanding this of you as this human instrument. But that human instrument has to start off with respecting themselves for your own needs, right? It's just so, so important because I often believe in this. I used to study empathy in the context of a stigmatized condition, lung cancer. And one thing I did learn from lung cancer patients is that they are already primed to look at people to see, are you judging me? And they're looking for that by cues, by my behaviors in terms of how I interact with them. And I often believe that still, and it might depend on the stage of that person dealing with dementia. I do believe they're looking for cues in terms of, are you responding to me out of a sense of support and non-judgment? Because I think that's often happens when people react negatively is because they believe they're being judged. I think that's so important. Next, what is your plan of action when you feel pressured in this caregiving situation and now you're being called to act supportively towards this person who's acting out? I think before we enter that relationship or that encounter with that person, we have to quickly ask ourselves, what kind of a mindset am I in? Do I have my own agenda of care today? Prepared to hear that other person. And sometimes that can be summarized, and I'll show you this list, a list of unhealthy internal competition that's going on in terms of what you feel, in terms of your own beliefs and what you need to do. And I do believe that person picks up on it when they see that you're distracted. I think another thing is to watch our habit of judging the emotions and actions of others and maybe taking it personally. We have to be careful about that. Again, ask yourself, am I motivated to learn from that person today? Am I paying attention to subtle cues that they're trying to communicate, what their needs and beliefs are? I think it's also important to let them talk and listen, and really listen with intention, to understand where they might be coming from. Because I do believe in this world. For example, I work with a lot of young people, and I believe their brains often are being hardwired because now they're communicating differently on their mobile phones, right? And I do believe the scientists are beginning to talk about that, just being hardwired to communicate differently. And I know this when I talk to my nephews, they want quick answers, just like texts that they get on their smartphones. And they're not really listening to what I'm trying to say. I do believe as a family caregiver, when we interact with people who are expressive in behaviors that we don't understand, we have to enter it accepting. This is no ordinary conversation that we're used to having with people. It's done with intention on our part to try to understand and listen better. Next slide. We skipped one. Go back one. A whole bunch of egocentric thinking perspectives. And we all do that because I believe we're hardwired to draw on our own experiences, but sometimes we get it wrong, right? Because that person is different than I am. But just to quickly review this, you might say this to yourself about that person's behaviors, about having the diagnosis of dementia. I believe it to be true. And that's when we don't really question our long-held beliefs about that person's behaviors, right? Because all we're really drawing on, especially when we're new to caregiving, is on previous behaviors, and we're trying to understand why that person is now behaving this way to us. Or we might say it's true because we believe it's true. What do you believe in your family unit about health and illness? You might say it's true because I want to believe it's true. For example, we might say, you know what? I think behavior might get better, right? And let me help them by trying to rationalize it with that person dealing with dementia. Or we might say it's true because I always believed it to be true. And again, this might be long-held beliefs that we had about the relationship with that person. And we engage in self-validation, you know, really underneath that person is the same. So we don't challenge these thoughts. It might be in my selfish interests that this is true. And again, it's about self-reflection and challenging ourselves, confronting our long-held beliefs. Do they hold true anymore? So, these are different stances that we might come from when we self-reflect. Next slide. So I want to finish off, and I don't know how much time we have. I haven't gotten the time out yet, but I want to share with you an exercise that actually an educator uses in adult education, and she calls it the life exercise. I would go back. Yeah, good. And they call it the life mnemonic, and it stands for, L stands for listen, identify, for I, feeling, that's about yourself, and E, exchange. Really, this model is about understanding to promote the common good. And in the family caregiving situation, I'm now calling you to see the situation is that the common good is for yourself and the person that you care for. She uses this to try to teach environmental awareness, but trying to promote it in a way to understand others in the viewpoint of the environment in terms of, in relation to how you think about the environment and the needs to address the environmental needs. Now we're applying this mnemonic in the family caregiving situation. It's a connection also with your own feelings, which I've been saying over and over again is so important in this situation. So let's just quickly review each of the letters and what they stand for. Next slide. Life, L, means genuine interest and curiosity. We're all born with curiosity. And as I teach my students, sometimes that gets stamped out of us when we want to, we don't really want to self-reflect. We want to make quick decisions. But really, the life mnemonic and listening, it starts off with being curious and asking yourself, am I motivated to learn from that person? And then when we speak with them, are you speaking with integrity in terms of, I'm here for you and I'm really going to try to care and try to understand you better. And it's about communicating based on good listening. And remember, we're listening to reply from that person's stance, as opposed to just simply giving a response from our own agendas. Curiosity, when people sense that you're curious and you lean in, the response is just so different. And I know I've tried it myself with patients, and it just opens up the doors. I know it's hard to do sometimes when there's things that we need to get done, but it's just so important when we're trying to get a more, develop a better rapport with people. Next slide. I stands for identifying emotions. You know, how are you feeling when people react negatively towards you? What are they trying to tell you? Also, to ask yourself, what am I feeling? That's just as valid, because chances are that other person is picking up on your feelings as well. So you have to do a self-check as well. Next slide is feelings, again, related to this. But what we're talking about when we're listening, we're also trying to understand where that person's coming from. And perspective taking is a part of empathy. It's called actually cognitive empathy. There's different kinds of empathy, but this is about trying on the other person's perspective. I know it's not easy to do. The key barriers in terms of trying to understand another person is fear, embarrassment, sadness, and frustration. And when that happens, that means it kind of prevents us from trying to understand what that other person's trying to tell us and respond to them from their perspective. Okay, so I also give you a quote here that comes from a nurse that works in dementia care. And this is what this nurse learned. It's about stepping inside someone else's shoes who has dementia and seeing their perception of things, that everyone is so different and each situation is so different, and that what might threaten one person doesn't necessarily threaten another person, and it affects on how I react to them. So you could see there's this dual thing going on in terms of understanding the other person, where they're coming from, understanding oneself in order to sort of know where you're coming from, and knowing now the need is to step away from myself, at least momentarily, to try to respond that from that other person's stance and not making assumptions about them. The last letter in the next slide is E, the exchange. I often tell this to my students, and I think this applies to clinicians and to family caregivers too. Whenever you try to seek validation from as if you're inside that person's shoes and seeing what they are seeing. And you say, you know, Mary, I'm going to pretend that I'm you. And I'm going to say something to you. And I really want you to tell me, am I hearing this correctly from your perspective? As if you are that person. Try to take that stance when you're responding to them. And really, you know, that does something in our mind and makes us more motivated to try to get it right with them when we take that stance. And it actually kind of helps us work with them to find solutions in terms of trying to find how to meet their needs. Okay, a couple more slides and then I'm done. I also wanted to share with you what I learned from a clinical nurse specialist who was working on her doctoral degree with me. And she shared with me the VIPS framework. And it's another evidence-based framework in order to help us as caregivers promote patient-centered care to understand the patient's needs. Next slide, and I'm going to describe to you what VIPS stands for. The first one is about valuing that other person. And you could ask yourself, do my actions show that I respect, I value, and honor this person? Whereas I stands for the individual. Am I treating this person as a unique individual? Is something you could ask yourself. And P is about perspective taking. Remember, I told you this is about really trying to understand where that other person is coming from and what they're trying to tell you. And you could ask yourself, do I make a serious attempt to see my actions from the other person's perspective? How might my actions be interpreted by them? And then the last thing in BIPS is social environment. Do you provide a social environment that welcomes them to confidently tell you what their thoughts and feelings are, and that they're not alone, and that you're in their space, and that you're willing to hear what they have to say? That's the BIPS framework. So in a nutshell, really self-reflection and empathy and trying to develop therapeutic relationships, I think, are the first steps that we need to take to understand, to try to develop a better sense, a better skill set in terms of how to get it right with our patients, because I think that's really important. And I could see that today with my husband when he talks and he self-reflects with me, how he really wants to get it right by his mom. And I'm sure many of you feel that way as well. And I know I did as a practitioner at the bedside. How do I get this right? And it often meant freeing myself, at least momentarily, for 3 minutes, spend some time with people, try to understand where they're coming from. So self-reflection as part of empathy is important as part of patient-centered care. And that's all I wanted to say. We also leave you with some references for those of you who like getting into some of the academic literature. That'd be great. And also I put some references on the bottom of the slides if you wanted to take a look at what the Alzheimer's Society says about this kind of thing, about perspective taking and self-reflection. Thank you. Any questions?
Hi, Michelle. Yeah, there have been a few questions that have come up. One of the questions that has Carla has put up is, where can caregivers go through the process of identifying and understanding their personal values, their caregiving role values, and whether there is a disconnect between these two value systems?
Right. Now, Victoria, maybe I could draw you in on this. We're working on a flip book, right? To help people walk away from such a presentation that I give so that they can work through it quietly, right? To answer these questions about your values. Yeah, you can't answer these questions here. This is sort of to introduce you to this important part of really paying homage to you, your self-reflection. How you do it, I mean, is paying attention to some of these, looks like basic questions, but they're not always easy to answer. But then reflecting on this new role that's being expected of you, and what is the healthcare professional caring for your care recipient expecting of you? Because that sort of helps you identify what they're expecting of me. Do I feel comfortable doing that? Do I feel I can express my values in my caregiving role, which is so important? And that's more about injecting yourself, but it does definitely call for more homework on your part. The whole intent here is just to put out some general questions to you so you can walk away and begin to think about this in terms of having this fit. And sometimes I often think interior designers get this right. When they talk about, so what do I do with the space? There's this barrier, this load bearing post, and somehow they work at a beautiful thing. And I think something we have to do, and I think Victoria, you use this language with me, we have to muscle through it somehow. And this is the whole point of developing a workbook for you, to try to muscle through this. And the space is yours in the home, where you can try to almost experiment sometimes a little bit in terms of, how is that person reacting now when I'm trying to express my values here in the care that I provide? I think is really, really, really important. Great
Absolutely.
question.
All right, next question is from Jenny Armson. caregiving role values, how are these defined?
I think caregiving role value sometimes has to be worked through in terms of, the first time when you realize that you're a caregiver and you think, now what? And it's almost like you almost have to create your own philosophy of care, especially if you're caregiving in the home. We all know that when we go to the hospital, there's another set of rules, right? And sometimes there's certain liberties that we had at home that we kind of have to give up. And we, as caregivers, we try to very often, as we learn about caregiving, we try to mimic sometimes what the professionals are doing. And when that happens, I try to be reflective in terms of how do I inject more of myself here? So it's almost as if in your personal relationship with this person, you have to develop your own philosophy of care and ensure that when you do that, you understand where you're coming from when you interact with the care provider, right? The physician or the nurse practitioner or occupational therapist, that, this is the perspective that you have been coming from as as a family caregiver. So it's almost as if you have to create this for yourself in this personal interaction with your loved one, but respect it and be able to speak to it, even on a sheet of paper, which is what we get our students to do as well. I think that's a good exercise as well that we didn't talk a lot. And it's a great question that you ask. But it's something to work on for sure, I think. Probably facilitated by the healthcare professional as well, right? Because as a caregiver, family caregiver, I think you're trying to marry two worlds. There's the personal world where you are involved and the care recipient. And then when you interact with these healthcare professionals, you want to try to marry the philosophies of care. I hope that helps.
Absolutely.
I'm suggesting more work, right? Yeah.
I think it's a process, and I really believe that if you take anything away from this, understand that this is all a process, and you'll go through these exercises and these experiences more than once.
Yeah.
So
we change, and the care recipient changes too.
Yep, exactly. All right, we have another question here. How does a caregiver understand the needs of patients with dementia who have already lost their cognitive and communication abilities?
I see. Yes. I'm trying to draw on the experiences my husband is having right now. And his mom she's deteriorating fairly fast in the hospital with her dementia, but they're changing her medications as well. And a lot of times he says he has to pick up on the subtle cues. And very often it's in the movements that she's had. And I do know that he draws on his previous knowing, the privilege of having known that person, and often sometimes trying to interpret what they're trying to say. I know his mother was always a clean person, very took pride in her appearance. And the fact that it was just that she made such movements, such urgent movements to get out of bed, even though there were side rails there, and she's fallen once before out of bed. He's trying to interpret her need to remain comfortable in her bed and not making a mess. So it is a matter of being able to interpret how you knew how they were before the dementia, and if they're giving you clues in terms of their movement, what they're touching. Maybe they're concerned about their hair, maybe they are concerned about wrinkled sheets. They look like they're a mess, or they're really trying to get out of bed. So I think sometimes we are lucky when we know the person. I mean, it's a double-pronged sword for sure. It's torture seeing what people are trying to say to you, but I think that's an important resource, drawing on what you knew about them before and trying to deliver the kind of support based on what they would have wanted before. I think that's paying homage to who they were before. I hope that helps.
Absolutely. I have another question here that I thought was quite interesting. I have a habit to interrupt and am very eager to give a comment or solution as soon as possible.
I know.
How can I fix this unhelpful habit, please?
Yeah, it's exactly what I said about whenever we start entering into these conversations with people who are dealing, with cognitive decline. The conversation's different now. It's about intentionality, right? And you may not, don't make assumptions that they're always going to understand you the first time. And the point is thinking out loud to yourself, what is your agenda, right? What is your agenda before you enter that conversation? And if it's about meeting someone else's needs, or you have to do something else other than being there, you have to cross-check yourself. So there is some mental gymnastics that you have to play with yourself, and do a lot of self-talk too. Again, revisiting that slide. What is your agenda? What is motivating you to be with that person? And are you willing to learn from that moment? So you do have to cross-check yourself and stop yourself. Ask yourself those questions. That will slow you down. That will slow you down. And maybe you might put certain boundaries in terms of the amount of time that you have with people that you have. And you think to yourself, I have 2 minutes. So what's the best approach to take? Question your agenda with that person. That might slow you down. I do think people sense when we're impatient with them. That sort of stimulates, that's a trigger for them to say, stop, listen to me.
Mhm. Absolutely. I am a caregiver for someone who has a cognitive disability, and I can tell you that she knows when I'm losing patience, and she knows when I'm frustrated,
Yeah,
and I have to work very hard to make sure that I'm on top of those feelings and I'm coming from the right place. Otherwise, she catches it, she perceives it, and she shuts down.
oh, that's so important what you just said. You just triggered a memory for me. What my husband, I get feedback from my husband, right? And of course, I'm going to hear everything about the care in the hospital. And he tells me that his mom is trying to tell him something, and but he also wants the nurses to hear, and they just come in and they say hello, Annie. What can I do for you? But they never stay long, not long enough to hear what she's trying to say, or even listen to my husband who's there. And she becomes more agitated. And he says she becomes more restless because she wasn't heard. I hear what you're saying. I really firmly believe that they are watching. However they're interpreting it and how it shows itself in behavior, it's a little bit different, right? Because it's hard for them to communicate, but they know about behavior.
Mhm.
Yeah, thank you for sharing that. That's important.
Well, something I learned from the autism world is all behavior is communication, whether it's
Yeah,
verbal or nonverbal, it is all communication.
absolutely. I often believe that's where we get into trouble, is when we don't really stop and listen to hear. Sometimes we stop to listen to give a reply. I think it's important. Those are wise words to listen to. Yeah.
They're not always easy to listen to.
No, not when we have other people pressing on us, right, to do
Mhm.
things. Yeah.
Yeah. All right. Another question here. How do we influence in a positive way the paid caregivers involved in our loved ones' lives so that they may incorporate more of your ideas around self-reflection and empathic listening and hearing? I find it hard to see how some of the caregivers involved with my mom's care are rather dismissive of her. Rather than speaking to her or including her when we chat, they speak about her when she's right there. By
Exactly.
example, is how do I try to approach it, but I find it frustrating.
It is frustrating. My husband's frustrated here. What you just described is exactly what he described. And the thing is, you want to know how do you get that to draw them in?
Mhm.
I said to my husband to say this because healthcare professionals are trained to help. And when you say to them, say the nurse's name is Michelle, Michelle, I need a moment of your time. I need help. Help me. And if you say those words, help, I think that would help to pause what is happening when you feel ignored. When you say, I need help. I need help to help my mom. I need help to help you help her here. So just simply, I need help might stop them. And I asked him to experiment today. I wonder if he's going to do it. Perhaps you would try that too, to get their attention. I need
Yeah,
help.
I've got a tough question here. Just a comment that a counselor specializing in caregiving and seniors issues can be helpful to work through self-reflection. And then the next question is, do I really want to argue? That's a great suggestion, but what is the best way to handle this when the person I'm caring for is strongly opinionated, but now makes, ridiculous comments? Do I just agree, no matter how ridiculous, or do I change the subject? That's one that might, we're going to have another webinar coming up in a few months around having challenging conversations and interactions with our care recipients who are experiencing dementia. We're going to have someone from the Alzheimer's Society. She's going to do a podcast for us. So listen for that podcast, and hopefully we'll be able to help answer that question in a bit more detail then. Because it's not easy.
Thank you for that. That sounds like an important one. I had another thought too. Sometimes if people have trouble communicating, they're saying it, but they really mean to say something else. So it's almost like, yeah, you enter it with intentionality, right? And you try to hold back, understand you're not hold it back, but at least momentarily be motivated and curious to say, like, George, you're saying it this way. I'm trying to understand what you're saying. Can you try to say it a different way? Do you know what I mean? If perhaps try to help them express it differently so that you can understand.
It's
I
not
don't know.
easy. It's not
No, I
easy.
know it's not easy.
I struggle with it in my own family with my daughter. Sometimes she'll hold on to an idea and it may or may not be accurate. And I have to give her the space to have that belief while still disagreeing with her. If I just agree to try and get it over and done with, she picks up on that and she feels dismissed.
I know. Yeah.
So
they do.
It's not always easy. There's not any kind of quick answer to this one.
Yeah, and there might be a couple solutions that you might be able to pick up on from that workshop, right?
Yeah.
Like one size fits all might not hold true. Yeah.
Yeah, it's always a challenge for sure. Here's one. I'm noticing another resident is becoming agitated with other residents and striking out. How do I dissuade her from attacking others? Distraction isn't working. She won't be distracted. That's not an easy one to answer either, and it may not be one that we can answer here.
Right. Yeah, because we were talking more and this about ourselves and how we're reacting. I mean, yeah. I think that would almost be a workshop, like how do you deal with conflict, right? Yeah.
Yeah, that one might be a bit of a triage with the care team, even family members of the person who is acting in disruptive ways. Might take a little bit of strategy to get around that one.
Yeah, you kind of wonder why that other, if it's a known fact that they don't get along, why are they in each other's space?
Yeah. Another comment here. I think your comments about drawing on what you know of your loved one before and paying homage to that when trying to understand and interpret what they are communicating. It's wonderful. Thank you.
I think that's what my husband does. I think that's why he comes home peaceful, even though it's disruptive for him to see the behavior she has in the hospital. But he knows he's coming from a place of knowing her before and trying to, flow through what he does for her. That's why he always feels so far. okay with what he's doing for his mom. Yeah,
Yeah.
thank you.
One last one here, because we're just past 11, so we've got to let Michelle get back to her busy work life. James Boggs asks, the idea of self-reflection made me think of meditation. Would a meditation practice be helpful in this context?
Yeah, you know, I think today we talked about self-reflection being done quickly and being done slowly, right? And the idea of meditation, I think, is really, really important when you have that space to take time and really be observant and take note of, you know, what values are flowing through you and how you feel in those kinds of situations. Self-reflection sometimes before you immediately enter the conversation with someone, and sometimes it has to be fast in terms of cross-checking what your agendas are and what you're motivated to learn. But meditation is really, really good. And I think now you hear a lot about self-compassion, which is all drawing on this, and another word, sorry, academics like all these words, self-compassion, probably done through meditation. Mindfulness is so important, being present where you are and acknowledging where you are and what your feelings and beliefs are. So meditation could help bring you there in terms of self-reflection. I think that's a good point. Yeah. Creating opportunities.
I can definitely agree with that. I think one of the benefits of considering a meditation approach is that when you meditate, you're forming a behavior. And if you can form that pattern, it will help you in many areas of your life, including this one.
You know what that reminds me of? What I often tell the students when I'm trying to teach them how to read research. And I said, you know what, when you learn, this is a new skill, but guess what? It's hard because you're exercising a different muscle and you're trying to develop that muscle. And it sort of relates to what you're saying, Victoria, about learning a new skill and a new behavior. You're developing a new muscle.
Yep. You can't just expect it to happen overnight. It will take a little bit of practice going over it over again and again. And it's not always going to work. Sometimes I guess wrong.
Right. Yeah, and forgive yourself.
Mm-hmm.
Yeah.
That empathy needs to be reflected back to you as well.
Good point.
Yeah. All right, that's it for the questions we have. We've had a lot of comments of thanking you for this wonderful information. This workshop will be available. It's going to take me a few days to sort of edit it and put in the introduction and that sort of thing, but it will be posted on our website within a week. And once it is up and ready to be viewed, I will send the link to everyone who attended and everyone who couldn't actually make it today. So, and when our flipbook becomes available, I will come back into this list of folks who came to this webinar and I'll send it out to you as well.
Oh, perfect.
Yeah,
Thank
absolutely.
you.
It's sometimes hard to remember where you found a tool. We try as hard as we can to just put the tools in your inbox whenever we can.
Oh, thank you, everybody. I was so happy to be here. I just wish I could see everybody's faces, but hey, these are the signs of the times, right? I'm glad you're here. Thank you.
All right. It's been an absolute pleasure, Michelle. Thank you so much for the time that you've taken for us today. And we really look forward to working with you on the flipbook. We're also hoping to make a variation of this available to healthcare practitioners because they are a slightly different audience than our caregiving audience, but they also would benefit from these tools.
Yeah. Thank you, everybody.
All right.
Thank you.
Take care and goodbye, everybody.